Dr. Ross, I've often heard you say that there are mistakes made in diagnosis of Alzheimer's when patients see their family practitioners regarding memory loss, and immediately they're put on Alzheimer's medications. How often is the diagnosis incorrect?
The diagnosis of Alzheimer's disease is incorrect in up to 30% of patients that come in to memory centers like my own. What do I base that 30% on? A study was recently published and presented at the International Conference on Alzheimer's Disease in Monte Carlo last October 2012, where many hundreds of individuals enrolled in an Alzheimer treatment pharmaceutical trial consented to undergo that very PET scan I had talked about earlier, a PET scan looking for one of the hallmarks of Alzheimer's disease called amyloid. All subjects that were enrolled in this study were diagnosed by very well-known and very experienced, including myself, specialists in the field, and we felt that these patients satisfied all the diagnostic criteria to explain that their memory loss, their early dementia, could only be due to Alzheimer's disease. A subset of these patients, like I had said, approximately several hundred, underwent PET scans, and only 70% approximately, in fact, had bona fide amyloid plaques consistent with Alzheimer's disease, suggesting, as you had said, Mark, a percentage, a not insignificant percentage, of individuals were diagnosed and treated with medications for Alzheimer's disease when the testing had been done to suggest it must be one of the other causes of dementia, but unlikely to be Alzheimer's disease.